It's time for Mrs. One's dental checkup. She doesn't know yet if she has any problems, and she doesn't really want to visit the dentist's office to find out. Mrs. One lives in long-term care, so a trip to the dentist is a big deal for her. Fortunately, these UBC dentistry students have something that might save her the trip. It's a mobile app called ToothPortal. It's the first of its kind, and it's being tested this year as part of a UBC dentistry research project.
It's very difficult to get treatment done in long-term care settings. So elderly, frail, older adults in long-term care are not receiving the care they require.
Teledentistry, like telehealth, has taken off since the COVID-19 pandemic. This new app is on the cutting edge. It collects photos and other information from the patient and sends it securely to the dental clinic at UBC. The patient never has to leave their home, at least not for the initial consultation. Inside the clinic, students and their instructors review the information sent from the patients. They'll use it to decide what the patient needs and what the next steps should be. They might bring the patient in for an appointment. They might refer them to a specialist. If somebody needs care urgently, they can schedule priority appointments so they don't have to wait long.
If we can eliminate that first appointment by bringing in information that we can triage the patient to determine what is the urgency of care, what needs to be done, we can then schedule an appointment and deliver care at that first dental visit.
Dr. Chris Wyatt and his team developed the app with funding from the Tai Hung Thai Charitable Foundation. The app keeps all the patient's data secure and well organized, so it can be added to their permanent health record and be accessed by all their care providers. But the app's usefulness doesn't have to stop there.
I think this is just the beginning. For remote communities, triage could be done and a proper advice could be provided whether the patient needs to be flown out of a remote community to come see a dentist, or whether they need to make that trip, or whether we can give them some friendly advice on what to do to help solve the problem.
Until it rolls out more broadly, UBC students will help long-term care staff get comfortable using the app. They'll continue to get practice interpreting the data and making triage decisions, and patients like Mrs. One will get the care they need without making any unnecessary trips.